jump right in here. We had a bunch of questions, and I will tell everybody we're not going to get to all the questions today, especially the ones that most recently came in, but we will then tune in next month to see the answer to your question you asked this week. Okay, so Dr. Copeland, I have a 12-year-old daughter, nonverbal and still in diapers. We have always had problems with meltdown, but as she is getting older and stronger, so are they. I heard that broccoli can help. Is this the green or a vitamin form? So talk to us about because a new study came out about this.
Oh, right. Well, first of all, with meltdowns, always do your ABA, get that functional assessment. What is the function of the problem behavior? Work on it behaviorally, but you can also support the nutrition and the metabolism. So the study related to an active food ingredient in broccoli called sulforaphane. And yes, it can be in the natural food. It's particularly highest in broccoli sprouts, but there is some in mature broccoli as well. They also make pill form for older kids who could swallow pills. It's generally pretty safe. It's spelled, there's different spellings, but one way is sulforphane, sulforaphane. So you could look that up on the internet. The neat thing is you can grow your own broccoli sprouts in a jar sprouter that you get from Amazon.com, and Park Seeds makes some organic seeds. They'll sprout in 3 to 5 days. You can periodically harvest your own. And sulforaphane, it's a good antioxidant. It's good for you, the parents, and one scientific study showed that because of its antioxidant properties, it really significantly helped the behavior and clinical presentation of individuals with autism. They ranged in age from about age 13 to 27, but even little children can have sulforaphane in their broccoli sprouts.
And so, Dr. Copeland, is this something that's a prescription, or we just buying it over the counter?
You can buy it over the counter. It's really pretty safe. And I think a great way to get it is through your food. So any of the cruciferous vegetables, like your mature broccoli and Brussels sprouts, will have some of it. And it depends on how you cook it. Steaming is a little better than microwave, and those are much better than boiling. You don't want to boil it for a long time because that will destroy the sulforaphane. So I think a natural way to make it is to just grow your own broccoli sprouts. Very easy to do in a sprouting jar. Okay. Very inexpensive. And you want to be careful with your green smoothies because you don't want to use a lot of spinach or high oxalate type of green leaves in a smoothie. But the broccoli sprouts would be very nice to do in a nutritious smoothie.
Wonderful. I'm going to move on to this next question. Hi, Shannon and Dr. Copeland. So happy to get some feedback on my 4.5-year-old son's health situation. Around May last year, the pediatrician put my son on Claritin because he was getting frequent colds with coughs. He missed about a month of school. This year around October, they switched him to Zyrtec, but they never ran any tests besides visually inspecting his nose. No allergy tests were run. They switched him to Zyrtec because they said he could be getting immune when he started getting sick, often with his main symptoms being stuffy nose and coughing. During this time, since October, my son has been sick and is still sick. He has had 3 eye infections like pink eye. We went to the allergy, sinus, and asthma specialist. He was put on prednisone for 10 days, antibiotics, albuterol, montelukast, I hope I'm saying that right, and fluctinase. Previously, in November, he was on amoxicillin. After 8 days after this specialist put him on all these medications and antibiotics, he came home with a fever, and they put him on a 7-day course of amoxicillin now for 7 days since another antibiotic didn't work. They also put him on albuterol with Pulmicort for his nebulizer. I don't like all the antibiotics he has taken in the last month, but I don't know what else to do since he is not getting better. He now has pink eye again in both eyes. This is making me very depressed to see him ill with constant energy and appetite. He is already a skinny guy, 36 pounds, and he turns 5 coming up here in April. He is also missing school and therapies, and now he's complaining of his ear hurting and having water in it. I just don't know what else to do. He takes Rainbow Light vitamin and Nature Way Prime Modophilus for children. He does not eat a lot, but a pretty rounded diet. He was tested for gluten and dairy and wasn't allergic. Can you give me any advice on what I should ask for to do next to help my son? Vitamins, probiotics, what do you suggest? I'm desperate.
Oh, this is a very complex case, and of course, we really empathize. You're doing the right thing. It's good that you took him to the allergist. He definitely needs those asthma and allergy medicines. As long as the allergy doctor is treating him, you want to follow that. So the albuterol and the pulmicort are important. The anti-allergy medicines can help, and that would at least kind of temporarily somewhat stabilize him while you're trying to figure out the underlying basis for his various allergies and frequent infections. And that can be tricky and hard to do. But you started the basic steps by seeing an allergist. Some other things to think about. Yes, your question, you're already giving him a good vitamin, and you could do more of the probiotics, especially since he's been on frequent antibiotics to, try and help heal the gut from all of those antibiotics. So you're giving him Primodophilus. You could add Super Pro Bio Gold, for instance, from Kirkman Lab. That's one I like. Or the therapeutic from Claire. Those are some other potentials. And as we discussed, I think last month, the fermentable foods, if he'll eat a little natural fermentable sauerkraut. But medically speaking, some of this may just be being young and exposed to a lot of germs from other kids. Otherwise, healthy children can get at least one infection per month. Usually they're viral. But he sounds like he's had more than his fair share of ear and sinus infections. And so it might be time to ask his doctor to at least do the start of a workup of his immune system to see if there's an immune system problem going on. And a good starting place for that is to do a test called quantitative immunoglobulins. Check his immunoglobulins. There's a blood test for that called the immunoglobulin test or serum immunoglobulins. And particularly, not uncommon, individuals can have low IgA and then various types of low IgG, subclasses of IgG. And if you're deficient in some of those, you get more frequent infections of the mucus system. So the ears, the sinus, the lungs, and it can predispose or interact with allergy. So that might be a really important test to do, because if he is low in that, then his doctor might want to refer him to an immunologist. And then you could try the sulforaphane. Interestingly, sulforaphane not only helps autism in a study, it's also being researched to help with allergies and asthma.
Amazing. So say that again for me, the test that we want to ask the pediatrician for, the quantitative
serum immunoglobulins.
Okay.
And immune globulins. It gets pronounced both ways. And
is that a test that our pediatrician will have ordered often, or should we expect it if they're a little like scratching their head with that?
Most pediatricians should have heard of it, because immune deficiency of the immune globulins is not rare, especially IgA deficiency. It's not something we think of every day or order every day, but it's part of our training in medical school and pediatric residency. So I don't think they should be scratching their heads over it.
Okay. I love the idea of that. And that's just something that we can go to our regular pediatrician and ask for, right, and get more information. Really very exciting. Now, when we get the test back, will our pediatrician immediately know what numbers to look for? What should we be looking for that test?
They would give a range, and if they're normal, that's reassuring, and maybe he's just getting exposed to one bad bug after the other, and he just has to build his immunities. After about age 5 or 6, kids start getting fewer ear infections with their virus head colds and whatnot, just because of the growth of the head and the change in their anatomy. So if they're totally normal, that would be reassuring.
Okay.
You don't want just the total IgG. IgG is one of the immunoglobulins. You want to check some Ig subclasses. But if all of those are totally normal, it's reassuring. If he's low in IgA and or the IgG subclasses, that could explain why he's getting such frequent infections of the mucous membranes and why they keep coming back. And that, for that, the pediatrician would want to refer to an immunology specialist.
Okay. Great information. Great information. All right, moving on. Somebody writes in and says, "Hi, Dr. Copeland and Shannon. Thank you for your show. I love to watch. This show helps me to calm my anxiety as I hear positive advice. My doctor recently recommended an x-ray of my four-year-old's sinus and adenoids. He's been sick on and off for the last 3 months a lot. Before I put him through this ordeal and exposure to radiation, are there any other tests that could be run that would help me to put my mind at ease for putting him through this, like a sleep study? And thank you so much for your response."
Well, a sleep study may also be needed, but it's actually much harder to do a sleep study than a sinus and adenoid x-ray. I order sinus and adenoid x-rays fairly frequently, and actually I think that's a sign that your doctor's being a good doctor. The x-rays don't hurt. The heads and the structures of the head are not very sensitive to x-ray to begin with. And so the x-ray from a sinus and adenoid x-ray only has about the radiation of going out on a sunny day. So let me reassure you on that. I think the biggest issue is, would your child be afraid of the new situation? So, a little uncomfortable in the x-ray room and the big machine and new people. That would be the biggest issue. The x-ray is actually fairly quick once they get the child still for a moment, and it's painless, and it really gives the doctor a good information. A sleep study may be needed too but that's long and hard to do. It has to polysomnography. You need your pediatrician to order it. It takes a number of hours. It has to be in a certified sleep lab. They have to glue all kinds of electrodes to your child's head. So it's actually more of an ordeal to get, but it can be needed if there's really loud snoring that's interfering with the child's sleep, or long pauses when the child's breathing at night.
Yeah, I just had to go through 2 sleep studies personally myself, and both nights, and they were overnight, and both nights that I was there, the next room over was a child getting a sleep study, and it was different children both times. And I have to say, I felt so bad for the parents who were going through it, because it was uncomfortable for me. There's nothing really truly horrible about it, but they put all this paste in you want to talk about sensory issues.
Right.
It's a sensory nightmare. They put a bunch of paste in your hair, and then they hook all these electrodes on it, and it's sort of like you have this long flowing tail of cords that's hooked up to a machine, and then they go, "Now sleep." And, I wanted to say to them, really, is anybody ever able to get to sleep with all of this? I just know it was really difficult. And I, of course, and then you're hearing people in the next room, and I was hearing a lot of crying going on. So I can see where it's a huge benefit for parents to get those results, but it isn't the easy cakewalk that you'd think it might be. Oh, a sleep study, it's like going to a hotel, except not.
So in comparison, a sinus x-ray is a party.
Yeah, and over and in and out, and nothing attached to your child's head, much easier. And I would think if a child is getting sick again and again and again, and if they're asking to see the adenoids, that it's likely that there might be an issue then, Dr. Copeland?
Right, and it gives really useful information.
Okay, really, really helpful. So, Dr. Copeland, we have had so many questions about MRIs and EEGs. I think I've got 4 or 5 here, and I'm just going to go through them, and we're going to clump them all together. The first one, "Hi, Dr. C and Shannon. My son is 4. I was wondering, do you recommend your patients get MRIs? What other tests do you typically recommend if a child has fine motor, speech, and gross motor delays? What type of seizure tests do you recommend that are most accurate? Sometimes my son's energy levels and focusing are off, so not sure if it could be seizure or sleep issue, and thanks so much." Scrolling down, we've got more questions. Somebody asking about that their ENT is requesting a sleep study. Also wanted to check to make sure he's not having seizures. What kind of tests are more reliable to check this? He's 5, low weight, and some days he seems foggy and not able to focus and attend to questions that won't answer your questions right away. And thank you so much for your time. Appreciate your show. Another person who writes in and says, Lisa Ackerman on TACA Facts, which we show here on a regular basis, mentioned MRI brain scan and EEG. Is there a specific type we ask for? How often should we do this? And thank you. You are the best. Another person who says, I was watching the TACA Facts, and it mentioned that a child with ASD needs MRI and EEG. We have never been offered to do it, and before asking for a referral, I need to have a good understanding and reason for the doctor to agree. Would really appreciate your help and advice. Lots of love to you and everyone working on this amazing show. So lots of questions about the MRIs and the EEGs. Is it something that all of our kids should get, Dr. Copeland?
I don't think necessarily so. The American Academy of Neurology, their child neurology division, did not list an MRI as the standard part of the workup. It's tricky to do. It can be as difficult to do as a sleep study. You're never wrong for getting it. And if a family has a discussion with their doctor and they together agree they want to get it, that's great. What it shows is large scale anatomy. And most of the time that's either normal or there's maybe mild abnormalities that we can't do anything about. That's why, because it's hard to get, most of the time it doesn't show anything that we can get anything about. It's not absolutely essential, but you're not wrong for getting it. Where it becomes more important is if there is new onset of seizures or other symptoms like severe recurrent headaches with vomiting, double vision, other unusual neurological symptoms, evidence of problems with the nerves that supply the muscles of our eyes and face, for instance. If your doctor and you see unusual signs like that, then the MRI may be very important to get imaging of the brain to see what may be going on. But the MRI is not particularly helpful in evaluating things like fine motor delay, speech and language delay, sleep problems, and so forth. With regard to seizures, we do know that children with autism spectrum disorder are at greater risk than the general population to have seizures. And that is more specifically evaluated through the EEG brain scan. And like the sleep study you mentioned, you have to have a lot of paste on the scalp and a lot of wires connected to electrodes on the scalp. So it takes a bit of doing to get an EEG. If you definitely strongly suspect seizures, like the ENT doctor who says, I'm worried about seizures, you would definitely want to get an EEG. Now, a lot of kids with autism have these daydreamy, foggy, staring spells. And such spells may or may not be seizures. They don't always indicate a necessity to get an EEG, since an EEG can be so difficult. I've had parents try 6 times, and each time there was motion artifact and they never got any reliable data. And that's hard on a child and parents. So you want to do it when you really need to do it. And if you don't really need to do it, if you can figure out what's going on with those staring spells without going to all the trouble, there's some benefit of that. So if your child is daydreaming and staring off, which a lot of kids with autism do, or ADHD, or sometimes a child who just likes to daydream, if you're worried that it might be a seizure, what the neurologist recommend is that you touch your child's cheek. You actually touch their face. So don't just call them by name from a distance or tap them lightly on the shoulder. Touch their face and offer them their most favorite food, drink, activity, toy, whatever. If you can interrupt the staring, daydreaming spell, then it's not seizures. And that can bypass the need for an EEG when it's hard to do. So you definitely don't need an MRI and EEG on a regular basis. It's when you have clinical concern and you bring it to your doctor, and as a team you decide together, hey, there's the medical necessity for this because of the more severe symptoms. Does that help?
I think that really does. I think a lot of times, in my experience, parents will be making progress and things will be going along, and you get to a point where things stagnate. And
Good point.
And I think a lot of times that's when the MRI and the EEG thing comes up. So I'm not surprised that for a lot of these people, they're not hearing it as the first thing on the plate. I think it is something that comes up in conversation much later for a lot of families. And I appreciate you saying to us that it's not something that you need to do again and again and again. I know families that much later in the process then went and got an EEG, and for some of them it ruled stuff out, and so it wasn't necessary, but you wouldn't necessarily have known that. And for others, they discovered another piece of the puzzle for that individual child, that child was having very small seizures, one in particular that was happening in the middle of the night. And it was really helpful to them in how they continued and got past that point where things were stagnating.
Great point. Yeah, so there are, of course, times and places for both the MRI and the EEG. And you mentioned a really important one, that if there's a sudden change in the child's developmental trajectory, they were making progress with their behavioral treatment programs and so forth, and then it changes and they stall. That's of neurologic concern. That deserves further workup. Also, if the child is diagnosed to have certain genetic conditions that can be associated with autism spectrum, like tuberous sclerosis, that's known to have abnormalities on the MRI that are really important to document. So definitely there are time and place for both the MRI and the EEG. Also the first EEG may not pick up all seizure activities. So your standard routine EEG, in more severe cases where seizures are strongly suspected, you may need to do 24-hour video monitoring EEG and do it in more detail. So having a normal EEG in and of itself doesn't totally rule out seizures. So there's both ends of the spectrum.
Good to know. Kelby, do we have enough time for one last question, or are we out of time? Okay, he says we can do one more. Hi, Shannon and Dr. Copeland. Is it okay to try to give a trial of a supplement such as N-acetylcysteine without doing the blood test? What is the blood test called? And thank you for breaking it down so that we can all understand.
Okay, the blood test is called glutathione. Glutathioне. But it's actually hard to get a good glutathione test from most U.S. labs. You want both forms of it, reduced and oxidized. European labs tend to have it more. I think Great Plains Lab is developing a good form of the glutathione test. But you don't absolutely have to get that. Glutathione is a major protective antioxidant system in our body. Now, the nice thing about N-acetylcysteine, it's an amino acid. It's an amino acid we all have already had in our food, because when we break down our proteins, one of the amino acids that goes to make that protein is N-acetylcysteine. But the nice thing about it is this cysteine amino acid gets converted into glutathione in our body. And it's really very safe and beneficial, so you don't have to get a blood test before starting it as a supplement. And I encourage it. It's a good support for our mitochondria, which are our energy engines of our cells and so forth. So I think it's well worth a trial.